This series is about melasma. This is a different duck and much more challenging than post-inflammation hyperpigmentation or sunspots. This is typically due to hormones, and hormones, as we all know, they like to fluctuate. Sometimes they continue to be active and sometimes they shut down completely, and you can go years without anything and then they flare up again. When you have melasma, this is a skin condition, so please treat it gently and manage your expectations. Okay, because once you have it, you have it. And it's not something that's just going to miraculously go away. I have yet to find the products. I found really great products out there on the market, but when it comes to melasma specifically, you have to be mindful and manage your expectations. Now, first and foremost, melasma is a hormone influenced pigmentation. So we have these things called melanocytes. And what happens is it's a type of disorder that continues to produce pigmentation. So it's not just environmental, which is usually the radiation of the sun. It is due to our hormone fluctuations. It does affect men as well, but typically it is female dominant. And it is basically these symmetrical little brown or grayish patches that are along the cheek lines. You can get it in the actual forehead as well as in the jawline. And again, this is triggered by estrogen and progesterone, UV, and heat. Yes, heat, any type of heat. A steaming pot. If you go into infrared, sometimes people just working out their own body heats can cause it. Hot yoga, hot saunas, you get the picture. Some people have noticed that when they're cooking and they're opening up the oven, they get the big waft of heat. That can stimulate your melanocytes to produce pigmentation. And what basically melasma is, to simplify it, is basically your melanocytes are turned on. There's no off switch. So they're just hyperactive and they're just producing as much pigmentation. And typically we get this in, like I said, hormones, something like pregnancy. This is also known as the pregnancy mask. This is usually a common experience. Sometimes you can even get it over top of your lip from doing waxing. I remember that happened when I was wee but a young lass, and I remember did waxing on an individual, and she's like, I've got this like almost like this thing going, this mustache going. And, you know, of course, talking to my instructors back then, they didn't understand it as well. But as, of course, I became more experienced, I started realizing that that was, oh dear, of course, anything that causes trauma to the skin can increase your melanocytes to be active. And that's what happened. So yeah, not fun. But now I know, obviously, and I tell people of skin of color to stay away from any type of waxing or trauma to the skin. This is why I think dermaplaning is an excellent option for those of you who want to get rid of any additional hair. Stay away from waxing, stay away from even doing any type of, what's the other one I was thinking of? But this is when you do threading. There it is. And that can cause a little bit of trauma within the skin as well. Some people can get away with it, others cannot. When it comes to melasma, why risk it? We don't need a flare-up. The whole point is to calm it down. You'll find that you'll have flare-ups in the summer months, of course, exposure to any type of sun, and then you'll go down, obviously, in the winter months. Now, key ingredients, of course, are definitely going to be your typical, your vitamin C, your antioxidant. You want your tranexamic acid. That really helps reduce hormone-related pigmentation. Niacinamide, of course, which also helps to regulate pigment transfer. We can go into alpha-arbutin or kojic acid. These ones are excellent options, or even hydroquinone. This is a prescription. Now, prescription hydroquinone, there's pros and cons to using it. The pros are you only want to use it for a short period of time. This is going to be specified by your dermatologist. Please don't pick one up and just start using it. You can over-process the skin and cause flare-ups or what we call flashbacks. So please be very, very careful. Follow the directions clearly. And you don't want to put the hydroquinone over your entire face. You only want to put it in the spots where you have it. Use a very small amount. This sucker is potent. And typically what ends up happening is that if you go to a really good dermatologist and they have a pharmaceutical that can do a compound, sometimes they'll compound different ingredients to help, like niacinamide, or sometimes they'll put kojic acid or other products within there, but it depends on the individual. So if you want to go that route, you can, but again, limited period of time. There is the risk of flashback and it can be very hard on the skin. So please keep that into consideration when you're thinking of what would be best for your skin. And again, you can't use it longer than, I I believe 3 months is typically the highest point you want to do that. So when we're looking at that, there are some kits that I have found that work very well with melasma. However, the only kit that I have found to date is strictly for melasma. It does help with aging skin, but you cannot put exosomes with it. You cannot put, well, we could probably do plated with it. I think that one would be okay. But because it is a very strong product, it's not something that you can put a lot of extras in it. And it's a very specific routine. I am looking at other options for people out there, but that is one that is also on my shelf. So it's specifically for melasma. But typically you want to have your high vitamin C, you want to have some sort of retinoid within your skincare routine, and of course the other ingredients I talked about. But prevention is the key when it comes to working with melasma. So please keep that in mind. All right. I hope this helped answer some of your questions. If you have further ones, please write them in the actual forum. That's what it's there for. Typically, I can get back to people within 24 to 48 hours. However, if it's on the weekends or on Monday, which is my admin day, I do not answer them. So please make sure that you give me a little bit of patience and grace for that time, but I am happy to answer your questions. And thank you so much for watching this video.